in so that we can drain more urine from the patient. Okay, thank you so much. I will go to the patient after doing the hand washing, right? I go to the patient. Good morning, Mr. James. Or it's afternoon. I'm student Mwenya from Rusang University, and I've been assigned to do a procedure called catheterization, looking at your condition that you cannot pass urine. So we need now to help you and drain the urine using the catheter. So we need to catheterize you. This procedure is important because we need to drain out the urine. So don't worry, we need to screen for privacy so you don't have to worry. Is it okay I can go ahead with the procedure?
Sure, you can go ahead.
All right, thank you so much. So let me just go and prepare something so that I can assess where you are sleeping. I do the hand washing. I go with the gloves. So, Mr. James, I am back to assess you. Okay, so I will assess the general condition of the patient. The patient is responsive. The patient is able to respond. I will check where the patient is sleeping, if it is soiled and the linen are intact. So it's okay where the patient is the patient is sleeping from. Then I will just expose you, Mr. James, so that I can see if there is the urethra is patent. We can still catheterize. Okay. Okay, so the penis is clean, so we are able to catheterize. Then the next thing that I'm going to check is just the general condition of the patient. Okay, so as you are doing here, as you are assessing the patient, you are not only assessing the patient, the general condition, but you are doing a thorough assessment on all the systems, right? Because this particular patient, we understand that the patient is what? The patient is unable to pass urine, isn't it? So now you need to do a thorough assessment on the urinary system. Are we together? Yes. So when you are done with that, the next thing that I'm supposed to do is to do what? To prepare now the patient, right? Can I just have the trolley to be near the... No. Yes. So that we can prepare the patient. Okay, thank you. So I will get the Macintosh. Assistant, you can come closer, but the assistant has to wash their hands and donning gloves. It's okay. So you can just put the patient in lateral position. The lateral position, like that. Just a minute. So Mr. James, sorry for the inconveniencing. We just want to prepare you for catheterization. So I need to hold the patient like that. Okay. Then you can pull from there. Right. So, Mr. James, we are done with the preparation. The next thing, let me just screen for privacy. Then I go and prepare the trolley. Okay, thank you so much for your cooperation. So at this point, I need to remove the gloves and do the hand washing. So when I'm done with the hand washing, the next thing is to go and prepare the trolley. So remember, you're in the treatment room when you're preparing everything from there. You get the pack, you get the sterile pack for the same procedure, which is catheterization. Then you start now preparing. So at this point, I will just request, though the sterile, the cheater forceps is supposed to be on its own, but I will just request it to be nearer. You can just put it, but it's not supposed to be here. Okay, so at this point we need to prepare now the trolley, isn't it? So the assistant needs to be closer. Okay, the assistant needs to be closer. The first thing that we are going to prepare are the gloves, right? So the assistant can just grab You can get the glove, the sterile glove. Then you just show me. I read from this side. From this side, you can pass this side, so that you avoid crossing. Okay, so the gloves are expired in 2030, the month of April. They are potent for use, so you tear it down like that, away from the trolley, away from the trolley. Away from the trolley, from here, up. Okay, can I have the syringes? 3 syringes. So before you get the syringe, you can also get firstly the catheter. You can open the catheter in advance so that you can check. Yes, you can get the catheter. Catheter, it's there. No, not that catheter. Yes. Okay, yes. So now he has to show me the catheter. So you pass this side so that I can read what is there. When is it expiring? So it is expiring in 2028, the month of January. So it is potent for you. So you can just open. You are tearing from up there, the way we open the needles. From there, yes. No, the way we open the syringes, yes. So now, when I get this, I grab it like that, okay? Then what I'm going to do is to read what is there. So this is the normal size. This is the normal size. It's 18 fra. Then the mils that I'm supposed to, for securing the catheter, we are supposed to secure the catheter with 30 mils, okay? So I will drop it on top there. The next thing, since we are saying 30 mils, we have already prepared the syringes. So how many syringes do we need? We need 3 syringes for us to secure the catheter. So you show me what is there, the expiring date. So the 10 cc, they are expiring in 2030, the month of April. They are potent for use. You can just open it for me. Okay. Another one. So I can put it in that receiver. Up like that. Another one. Like that. The next thing is to put now the KY jelly. So the KY jelly, I can prepare it myself, okay? So the KY jelly is for lubricating the catheter, okay? So I'll just go down there and get the KY jelly. Now, if you need also to put the syringes, sorry, not the syringes, but the needle, so that you can now get some maybe distilled water that I could prepare for injection giving, you can still get that one, okay? You can still get. So at this point, what I'm going to do is I will get the KY jelly. So go around and get the KY jelly. Just to have the expiring date. So one supposed to avoid the KY jelly like that. Okay. I get normal saline for cleaning. Okay. Normal saline for cleaning. So I will read what is there on the label. Normal saline expiring June 2027. It is potent for use. You said this one is for the solution. Remember, you're not supposed to talk when you are here. Okay. Then the next thing, okay, the next thing that you're going to prepare is the strapping. Okay. This strapping we are preparing to secure the what? The catheter, yes, because it is supposed to be secured to the thigh of the patient. Okay. So the next thing that we are supposed to prepare, it's now the normal, the distilled water, okay? Water for injection, isn't it? So if this is water for injection, you read the what is there on the label and the pour, okay? We don't use normal saline. So the other, so if you have those bottles for water for injection, you can put 3, because for them they are 30, they are 10 mils each. So you can put in probably 3 of them. So at this point, you have already prepared the trolley, isn't it? Yes. You have prepared the trolley. So the next thing that you are going to do is to do what? To scrub, and come and do what? Perform the procedure. Are we together? Yes. Okay. So at this point, I need to go and scrub. Okay. So we just wait a little bit for the hands to be dry. Otherwise, we are going to have a lot of issues here. Okay. So we use the opening type of gloving. Okay. Assistant, can I have this? You can remove it. Yes. See, you can just take it. That's it. It's okay. So now at this point, before I drape, what do? I start now preparing the what? Okay. So we said one receiver. That's where you're going to put. So you're supposed to prepare at least 5 to 6 swabs, depending on how the assessment was. If you find that the glands is very dirty, you can even prepare 6 of them. If it is not, okay. Then the next thing you're going to do is now to prepare the what? This part. Are we together? Remember, this is closed, isn't it? So you need to open. Okay. So you're going to get this just like that. Then you put it in the receiver like that. Then the next thing you're going to prepare the same water, right? We said 30 mils. So you can put it there. Okay. So at this point now, you have prepared everything. You just have to catheterize now, isn't it? So the first thing, you tell the assistant to do what? To expose the patient. So we are only exposing the genital area, okay? So you can just expose so you can hold from here. Then just expose the genital area. Again. All right. So the first thing, before we do everything, we need to do what? We need to drape this particular patient. Like that. Only exposing the penis. Okay? The other drape is not supposed to be fenestrated. So the other drape can go there. Okay? Then the next thing at this point now, you need to divide what will be going to the patient and what will be going that side, isn't it? So the first thing is to do what? To pass first this swab. Okay? The gauze first. You get the gauze, you pass it this side, then you support it there. Are we together? The reason is very simple. I'll pass this one, isn't it? So now I'm not supposed to touch, this is sterile, isn't it? I'm not supposed to touch the patient. So I am going to retract first the foreskin. If the patient is not circumcised, you retract the what? The foreskin using the what? The gauze, are we together? Then you pull the penis like that. Then you start from here. Hello? Just around it like that. You throw it in the receiver which is receiving the dead swabs. You get another one, you pass it, you go there, then you go to the glands. Okay, circular. You throw it, you get another one. You go now to the tip of the what? The urethra, just like that. Okay. If you see that it is not clean, you can still do the same thing. Okay. At this point, you need to tell the patient to say, Mr. James, I'm done with the cleaning now. I need to do what? To catheterize. You may experience some painful sensation because looking at the condition, it will still irritate the urethra. Okay. So now, what do we do? At this point, okay, at this point, you can get this and you do like this, okay? Are we together? You do like this so that then if you have another receiver, okay? For example, you have another receiver which you are supposed now to receive, isn't it? You get this receiver and put it on top there because this part is sterile. So what do I do at this point? I am done with everything now, okay? The only thing that is remaining, this hand will not even go that side. So what do? I'll get this. Then I hold the penis like that. Are we together? Don't remove the plastic. Don't remove it from the plastic. Now, when you are inserting, you are going to be inserting it in a circular motion. Are we together? Yes. Like that. Then it will be going in. Okay? So at this point, I am going to get this what? Catheter. Remember the catheter is greased with what? KYJ, right? Then I'm not supposed to touch the penis. Just like this, okay? I need to put the gauze, the same gauze I used. So you hold it like that, then you insert it, okay? It will still go in. As we are inserting it like that, you're also retracting what? You're also removing this plastic, then it will go in. Now, for male patients, hello? For male patients, you make sure that this one goes in up to here, where it is making that wide. Are we together? So immediately it is in the situ, it is in the bladder, you will start seeing some urine coming out. Okay. And not only some urine, a lot of urine will now be filled with this. Are we together? So what do we do? The first thing, when you see that now the urine is, you get this one closer so that the urine which will be coming in, will be coming out, it will be dropping in the receiver. Are we together? So the next thing that you do now is to secure what? The catheter. What do? I get this, right? I remove this, okay? This is the catheter, then I remove this. I put it there because it is going to have a lot of urine. So what do? I can touch this part. I will touch this part, then I do like that, okay? So that I can secure the catheter, okay? So I'll push in to go in like that. We are securing. So this catheter is saying you need to push in how many? So you push in. Okay. Again, the last set. If you are in OSCE, during OSCE at this point, you can even be given what? The ISN. Now, if you want to pull it, it will still not come out. It is secured. Okay. So the next thing that I do is that if the assistant is nearer, I will tell the assistant to open the what? The urine bag. Okay. The assistant to open the urine bag. It's there down there. Yes, the same one. So you read the expiry date. And okay, you can tear from that side. Check the label. You are tearing what? How are you tearing? It is going down, right? So tear. Yes. There are these lines, okay? These. Yes. Okay. So I'll get this back. I need to secure now. Okay. So I need to secure. We are securing from here. Okay, like that. The same urine which was coming now, it will start now. You make sure that this one goes in like that. Then I get strapping. So strapping is supposed to be, you're just securing this part, okay? On the thigh, just like that. Okay. At this point, you are done. The next thing that you are going to do, this one is supposed to be hanging down, but it's not supposed to go down. Are we together? So some urinary bag, they have some ropes here, so you can just tie, just using the same bed rails, you can tie it from there. The next thing that you are going to do is to start now undraping the patient, because these things have been used on the patient. So where are you going to put them? You need to take them you need to take them for laundry. You give IEC. This one is going down there. Everything, we are doing what? We are removing everything. Then this one is supposed to be hanging down there. Okay? So you can even remove this. Okay, you will still remove this. The assistant will receive from there. Okay.
So, sir, even in real life,
Yes.
that catheter can end.
Yes. We're talking about real life here. The catheter will still go in. Just like that. And it will not come out no matter what. So catheter removal, you just start now removing the water. So you will just, for catheter removal, when you place here, isn't it? Okay? When you do like this, the water will still start coming. You can even leave it, since we want to remove. So at this point, you can even thank the patient for the cooperation. You dismantle the trolley, you go and report to the ward in charge, isn't it? At this point, you have already helped the patient. So the patient will be just getting where? From it. All the urine will be coming in. So the next thing that you are going to be doing is now to measure the amount of urine so that you can assess if the kidneys are still working or they are not working. Are we together? So this is how we catheterize.
So that bag is just used once.
Yes, it is just used once.
Okay.
And you need to be changing it.
Even the catheter?
Yes, even the catheter. The catheter can be there for 3 days. You will just be cleaning now. When you are cleaning, you will clean it from the urethra. Yes, it can be there from 3 to 7 days. So it can be there, but depending on the condition of the patient. If you see that the condition of the patient where there is discharge of a lot of pus, change it every day so that you don't risk the patient for other infections. We can still